Hey guys, welcome to the Best Practices Show. My name is Kirk Behrendt. I'm your host today, and you are in for a huge treat as I've got one of my dear friends in dentistry on, Dr. Uche Odiatu. And some of you might be thinking, how the heck do I talk to my patients about nutrition, or where do I even start? Because I got to put this all together for them in this optimal oral health picture. And there's nobody better when it comes to that conversation than Uche. So a couple things. I'm just going to say this. If you haven't been here before, I want to do two things. Number one, I just want to welcome you to an incredible community of people that are just committed to learning. So there's no egos here. Feel free to ask questions. Number two, I want to encourage you wherever you listen to podcasts to subscribe. I don't care if it's iTunes, Stitcher, Spotify, wherever. Make sure you hit the subscribe button below so that you can keep showing up with us every single week. You're going to see every single week. We'll bring you a new key opinion leader in dentistry with some great thinking so that you can create a better practice and a better life. Also, if you haven't joined our private Facebook group, make sure you join us over there. We're still trying to figure out how all these things work, but we started it last year in the COVID conference, and over 13,000 of you just joined, and it's very cool just to see everybody connect. So make sure you check that out. It's the Best Practices powered by Act Dental private Facebook group. Now, I want to introduce my good friend, Uche. What's
Hello.
up, brother? How are you, man?
I'm good. I'm
All
good.
right.
Another good day on planet Earth. I am raring to go.
Yeah, raring to go. Now, I always say this about you, like, I love you dearly. It's so much fun to have you on. Number one, you always bring great energy, great thinking, and you just bring this component to dentistry that we haven't seen before. And I love telling this story, and I don't mind. I'm going to tell it every single time. So I was speaking at the Chicago Midwinter meeting, and I got two of my team members with me, and they're like, we've kind of heard, like, is it okay if we go over and watch Uche? I'm like, you're going to watch Uche today. They're like, yes. And they went outside, and of course, the line goes all the way down. You got the velvet ropes with the security guards and the bouncers and everything. And it's just so much fun. So I just love having you on. Today, we're going to be talking about 5 things that every dentist needs to know about nutrition. But if people don't know who Uche Odiatu is, let's start there.
Okay. So I'm a practicing dentist in Canada. I'm still an international member of the ADA. So, U.S. dentistry is dear to my heart. I've been speaking since lecturing at dental programs probably for 16 years, 7 countries, 500 lectures. I've been an invited guest on about 400 TV and radio shows since 2002. Written a couple of books on fitness, more about the mindset than the how. Everyone always argues about the how. I'm talking about why, and philosophy is number one. I'm double certified as a personal trainer, professional member of the American College of Sports Medicine, certified yoga instructor, certified boot camp instructor, for crying out loud. Last 2 years ago, I got licensed as a Zumba instructor. So there is no end to my curiosity about wellness. And the key thing I like sharing with my colleagues is that to bring it chairside, it makes you seem like that authentic voice, because every patient almost seems to look at a healthcare provider that sees all of them and not just their hormonal system, not just their gingiva, not just their mind. Integrate the knowledge, and you can really get patients better. So my passion is igniting my fellow healthcare providers to look at patients from head to toe and enjoy a more integrative healing journey. How's that?
Yeah, I love that. Now, I always love to talk about the why before the how, because we're going to get into these 5 components. The nutrition conversation is always an interesting one, and this is a big part of it. I feel like there's so much of someone's health related to this whole area. And you've seen it for years as a practicing dentist. You teach people now nutrition. Why is this just hard? Why is the nutrition conversation hard for dentists and team members?
Yeah, great question. I think it's confusing because everyone eats. So everyone thinks they're an expert. Like everyone goes, do you eat healthy? Yeah, I eat healthy. Tell me some details. I go through a drive-through twice a day. I drink half a gallon of vodka at night. That's my liquids. I don't put any juice in because juice is fattening. So it goes on and on and on. So what I really do is everyone eats. So everyone thinks they're an expert, which is everyone eats, but not everyone's an expert, because the visual nature of how we look and how sick we are. If you're an expert, why is 70% of the population overweight or obese? Why is there 100 million either pre-diabetic or diabetic people in the USA? They all have dentists. So at some point, dentists, are we not doing what we need to do to help people get better? Because food enters through the mouth, unless you're G2 fed or IV fed. And so this is the gateway right here. We have to understand probably one of the most important aspects of what the mouth does is masticate. So if we don't understand the common threads and the foundational principles of nutrition, we are just basically fixing stuff and going, good luck with the nutrition, good luck with the diet. And they're going downhill because the number one inflammatory source in our lives is eating inflammatory foods, eating food that doesn't serve us well.
Right.
So this is why it's confusing. People think that they're experts because they eat. Two, they're listening to all the fad diets, which come and go. In the 80s, they said eggs were bad. Now they're saying up to 3 or 4 a day is fine for healthy people. So anyway, today, Kurt, with you, I want to bring some clarity and set up a mass or a philosophical mindset mass, which helps people steer a better journey, chairside, when they're talking to patients.
Yeah. Now, we did not talk about this before going live, but I want to ask you this question. My wife and I went to the Cooper Clinic years ago, which was the most comprehensive exam that, and it was amazing. Now, I was speaking with Kenneth and Tyler, and they said this: 70% of a human being's health is related to what they put in the hole under their nose. Would you agree with that? Disagree with that? I mean, everybody has their thoughts on this, but it was at that moment, and he was trying to help me understand how important the dental profession was to keeping everybody else healthy. Comment on that.
Okay, yeah, for sure. And obviously there's a point counterpoint. Like every time someone says this is the most important thing, people say, hey, how about breathing?
Right.
How about movement, right? Because rigor mortis, when people don't move and they don't feel a pulse, that's the sign of life is gone. You're doing CPR. So 70%, I would say that's a very good foundational set of the sail, but there's more to it. But definitely, it's almost impossible to be healthy if you're eating fast food all day, not eating vegetables, not drinking water, and drinking alcohol daily to excess. So I would say 70% for sure. It's probably the number one inflammatory source in most people's lives. And when we think of inflammation, think of overweightness and obesity, which is 70% of North America. So it's about 280 million people are overweight or obese, which means they're inflamed. And when you're inflamed, the body's incapable of being fully healthy, because part of getting healthy and part of the body working well is to do it in an environment where there's no inflammation going on. But when there's background chronic inflammation for being overweight or obese, the body is hampered. It's like playing tennis with one hand behind your back and your good hand. You're not your dominant hand.
Yeah.
So that being said, everything you and I say is to get people to take action. Like people always think, Uche, tell me exactly what I got to do. I can't sum it up in 45 minutes. You and I are going to talk about. Well, the thing is, if people actually listened to this 45 minutes and actually implemented it, I'm not going to guarantee it personally, but I could say, I guarantee you could get another decade of life. You can get another decade if you go from being obese back to your ideal weight. You can go another decade if you start eating a salad a day. You can have another decade of life if you eat more fruit and vegetables. You can have more decade if you cut out a lot of the fast food in your life. So you think, Uche, how can you tell me that? Well, the last 10 years of most people's lives is spent with they spend 80% of their medical costs. And it's simply about being too heavy, too slow, eating the wrong food, being inactive. So this 45 minutes, it's worth its weight in gold, if you ask me. It'll give people another 10 years. And even if they're going to do 10 years, if they're going to do it anyway, it would make it so they'd actually be able to enjoy them because they'll have mobility, no pain, clarity, no brain fog, those kind of things.
Yeah, I totally agree. You got me on the apples thing, and I got apples everywhere. And sometimes, it's really easy to grab the pretzels, or you could grab the apple. And I'm like, oh, Uche, you're in my head all the time. So break this down for us. Let's go through each one of these. What's the first thing dentists need to know about nutrition?
Okay, I'm talking calories because everyone thinks calories, right? Everyone thinks calories. I'm on a diet, calories. So people say, I'm going to start eating healthy. I'm cutting calories. Okay, you're cutting calories. However, do you know what you're cutting down to? Some of my naturopathic doctor friends and my osteopathic doctor friends share that if you start eating healthy stuff, it'll displace the poor quality stuff in your life, and your body will be satisfied easier. Anytime we're eating a lot of garbage food, nutritionally poor food, a lot of artificial sweeteners, canned food, boxed food, what happens is the body's appetite keeps saying, please feed me. And you got to think, Uche, how that works. The minute you start eating better quality, the body gets satisfied easier. That's why Godiva chocolates comes in little pieces, because you get satisfied easy. You have those little kisses with the twist on them. You need 1,000 to stop your hunger. You eat some of these, imitation ice creams. I'm eating a gallon. Meanwhile, you give me Ben and Jerry's. I need like a little personal pack to make me happy. So the better quality your food, the more your caloric intake will be regulated on its own. So
Right.
the first step of this is understand about calories and how we've been misled into thinking we all have to eat less. Meanwhile, you eat better, eating less will happen automatically because your body will stop searching for nutrition.
Right. Now go a little bit deeper than that, because everybody has a number on calories. I've been with you at dental, conferences, and you and I will go through the food line at the speakers with the speakers lounge. And, I'm like, oh my gosh, this morning. And I look at your plate and it is this high with meat and vegetable. I'm like, ooch, like that's got to be a ton of calories while I'm trying to be better. Can you talk? It's not necessarily what we normally think. Like, give us an idea of what I would normally think is daily caloric intake.
Okay, we'll keep hitting at the calorie thing, because that seems like people's biggest misstep is the calories. So when you see me with a big plate of food, realize it's not any one meal that makes people fat or unhealthy. It's meals eaten every day for a decade that make you unhealthy. So that's why at a speaker lounge, I could load it up with the most unhealthy food and mess with everyone's minds, because I don't eat like that all the time. But just to show and not make people crazy, I will eat healthier. But if you're eating a lot of nutrition dense, volume high, that's why you think my plate is crowded, and calorie light. When you go nutrition dense, volume high, which means lots of fiber, lots of vegetables, lots of salad, all of a sudden I can put a slab of meat on there and it looks like my plate is spilling over. Total calories, maybe 500,
right,
compared to maybe a Big Mac, fries, and a shake, which is pretty dense, but calorie high, 1,100 calories. And I could probably eat one of those probably in 8 minutes. But the meals that you see me eat in the speaker lounge is, it might take me 20 minutes, because it's volume high, nutrition high, calorie dense. So it takes a lot of chewing and eating. So chewing and eating, think dentistry. Chewing and eating, think good occlusion. Chewing and eating, think a good result with your Invisalign. All your quadrants restored. So the minute a patient's missing a quadrant, I'm thinking, they call it being a dental cripple. I'm not sure how politically correct saying a dental cripple is. But when you're missing a quadrant, what it means basically, now you're chewing on one side, and now basically you've actually created, when you talk about physically challenged, you're orally challenged and you won't chew as well. Because most people chew the same amount of times, whether they have 8 teeth or 30 teeth.
Right.
And some people have an easy time getting healthy because they're digesting, absorbing their food better.
Yeah. And, it doesn't always have to be boring too. Cause some of the, dieting is just hard. You're like, oh, now I got to eat boring. I can't have beer. You can still have fun. Like, I've been with you and you've had tequila. You can still enjoy certain things, where you don't have to give up everything. Correct?
Yeah, exactly. The muscle is the biggest, organ in the body. People think it was skin at 10% of the body weight. This is Dr. Oz from 2007. Bentog Pedersen, 2012, and Copenhagen Human Performance Center showed that muscle is the biggest organ, which is almost half of male or female's body. Whether you're Arnold Schwarzenegger, Melania Trump, Kirk Behrendt, Uche Odiatu, muscle is about half our body weight. But what happens is, though, if you have a little bit more, you have the most energetically starved body. Muscle acts like a glucose intake. It acts like a loofah sponge. So if I have more muscle, I have more muscle. What happens is, when I eat food, it's like if you drop something wet on your granite or your counter, and you try and mop it up with a piece of paper, it's impossible. That's someone with no muscle. But someone with muscle, it's like a loofah sponge or the best paper towel, and you can soak up that glucose so much easier. So if you want to have an easier time handling those occasional insults like tequila shots after the conference, or if you want to handle the dessert with a friend or a birthday party, if you want to handle the pizza, I'll eat pizza. You have a little bit more muscle. Your muscles become a loofah sponge for glucose. It's the biggest store of glucose is glycogen. So the more muscle you have, the better you can handle glucose. And you're thinking, Uche, what does that got to do with health? Well, diabetes, which is basically 100 million Americans are pre-diabetic or diabetic. So that's 100 million out of 300 million. Basically, the majority of things that diabetics will leave the planet 10 years earlier by They said the average diabetic, poorly managed, leaves the planet 10 years earlier. Cardiovascular disease is the #1 killer. And it's inflammation, nicks in the arteries, too much sugar. The body's pancreas is unable to pump out insulin and sop up all that glucose, simply because the person has lost muscle. And the average person after 30 loses 1% every year. So you get the 60, 70-year-old dentist with, they've lost over 40% of the muscle. Now when they have everything they eat, they get a bit of a glucose spike, and it lingers longer than if someone is healthier, leaner, and more active.
Right. And I notice whenever in weight training of any kind, you're always starving. Like I always find myself way more hungry when doing the weights versus just the cardio type of thing. So I want to go to topic number 2, because I just started this last year, and it's the intermittent fasting thing. Because you introduced us to it. This is a big thing. Like it's very effective, right?
Yeah, intermittent fasting is amazing. Fasting's been around for a while. Think of religious history. Thousands of years ago, Yom Kippur, Ramadan, the Catholic tradition on Friday night with fish and not eating certain foods on Friday. So the whole idea about fasting is that it gives the body a break from digestion. In human history, you go back a million years. Well, think of the little Australopithecus, that first little human. She was 4 feet tall. We had feast and famine. Our physiology doesn't know eating 6 meals a day. If the fact that we're eating 6 meals a day for the last million years in human history, that's basically only a blip in the how many million years human beings have been around for. So anytime we fast, anytime we don't eat, the body goes, hey, just like it was a million years ago. Hey, just like it was 100,000 years ago. And the body works better. Anytime we give our bodies a break from digestion, the body works better. We're not supposed to shovel food in all the time. Snacking is a huge industry. Meat snacks, corn dog snacks. People you can snack with it. You walk around some of these amusement parks, people have a 2-pound thing of turkey just snacking away, thinking, wow, this is a great snack. I'm eating paleo. You're not supposed to be eating for 3 hours, unless you had a starvation diet because your tribe wasn't eating 100,000 years ago. So intermittent fasting is very much physiologically compatible. And they've actually shown intermittent fasting, any schedule, whether you're missing a meal or whether you do 16 and 8 or 20 and 4, 12 and 12, is really good for the human body. Takes a bit of discipline, but like dentists know, we're very disciplined people. Add a little discipline to your eating. It'll pay off in getting that stomach flat. You'll get the 6 squares on the front. You'll get a bicep vein. You'll look 15 years younger. You'll practice another 10 years without pain. It's a beautiful thing when you handle the food thing. It's a beautiful thing. If you can work 10 more years, average dentist making $200,000-300,000 grand a year, what's that worth? $3 million. So by listening to today, the average dentist who can practice 10 more years, this 45 minutes is worth $3 million. $3 million, Kurt. That's the value we're giving today.
Yeah, it's awesome. And you got me going on. I use an app called Zero, and then I time it type of thing. But give us an idea. Like if I've never done intermittent fasting and I'm a dentist, like how would that work? Do you stop eating in the evening and then I try to go through the whole day? How do you do it during the course of your day?
Yeah, and experts often argue about the exact timing, 16 and 8, 20 and 4, 12 and 12. We still don't know enough about it. The fact that every 20 years, nutritionists look back and go, wow, we were hopeless 20 years ago. Looking back now on the fat was bad in the 80s. The decade of the 80s, fat was bad, carbs were good. People ate big plates of pasta, was artificial sugar, tons of sugar and things because people gave up fat. It was a very toxic decade. Between 1980 and 2015, the average American has gained 11 kilograms. We are almost 20 pounds heavier from the 80s, simply because of these diets that come and go. Even intermittent fasting, if we radically adhere to it, 50 years from now, they'll be laughing at the naivety at how we were putting it in. We've only scratched the surface of nutrition. As much as I know, as much as any nutritionist knows, a dietitian knows, we've still only scratched the surface. Just like back in this, I was talking to a patient yesterday. She was one of the first programmers, and she walked around university in the 70s with Fortran and Fortran cards, and they thought they were geniuses, big rooms full of computers. And now the average 8-year-old on their old iPhone 8 has more computer power than a 70s room full. Nutrition is the same way. 50 years from now, they'll be laughing at the elementary way that we're handling food. But all we can do is do what we can. Like Maya Angelou said, do what you can with what you got until you know better. And when you know better, you can do better.
Yeah.
Right? So when people try and find the be all and end all, and I love, Seattle study clubs, these are the keenest dentists in the world. They're in the front row. They got a personal trainer beside them, a virtual assistant on the other side, spouse on the other side. all learning together. Uche, what's the best way? What's the number one way? What's the most important antioxidant? I'm saying you start getting what is the best, we're going to be proven wrong 20 years from now. Right. So let's just look for guiding principles. So don't eat all day. 3 meals, 3 snacks a day, not a good idea. If you miss a meal, don't panic. So if you miss lunch and you work through lunch because you had to redo a case or you had to make it new couple of provisionals, just think, instead of thinking I'm starving, I'm doing intermittent fasting. Yeah. I'm lowering inflammation in my gut. I'm going to become more hormonally balanced by the time afternoon comes around. So missing a meal is not such a bad thing. Missing breakfast used to be like the sin. Now they're saying for different body types, you can miss a breakfast. Obviously, you can't miss breakfast if you're diabetic, but missing breakfast for most people a couple of days a week is intermittent fasting, and life-changing if you're suffering from a metabolic disease, and inflammation being the one fallout, and chronic inflammation sabotages almost everyone's health over time.
Wow. And it is amazing. Once you got me started on this, I was thinking I couldn't make it through lunch. And now it's a breeze. The first 2 weeks are always hard. You're like, oh, I'm starving. But then you train the body like, I'm good till the end of the day. It's amazing how the body responds.
And you don't have to miss breakfast every day. We're talking a couple of days a week because most of us overeat all day, every day. So I'm always a big believer in inch by inch, this is a cinch, yard by yard, it's hard. So start by just doing 2 days a week where you miss breakfast. Again, if you're diabetic, obviously you got to look at your blood sugar and look at, talk to your healthcare provider. But for healthy people, most people, missing a couple days a week breakfast, experiment with your energy level. Experiment with what you eat then at lunch and dinner. And experiment with how you look after 2 or 3 weeks. Because anytime the body is not eating, the body is healing. When you're eating, one of the biggest users of energy is mastication. Digestion, all 26 feet of our intestines, takes a ton of energy. That's why most people are tired after any big meal. So anytime you don't eat, the body's better able to manage what's going on inside. It lowers inflammation. You get better absorption of nutrients because the body then can focus on absorption rather than digestion. There's 2 aspects of food. One is mastication, digestion, and then absorption. People talk about what you eat. It's what you absorb that counts. And if you're missing some meals every now and then and eating in smaller amounts of time, the body's more efficiently able to digest and absorb nutrients. And it's life-changing. So you could be in your 40s looking like you're in your 20s. I'm in my 50s now, chin-ups 15 or 20. I'll go into the gym. I'm working out with guys half my age. And they think I'm some kind of elite athlete. I'm like, no, I work out in my spare time with a random intuitive program. I'm a dentist. And they're like, how's that possible? You're older than my dad and you're stronger than me. Do you work out 2 hours a day? Never more than an hour. And then I got these crowd of 20-year-olds asking me, okay, doc, tell me what's going on. Yeah. And I'm like, come to my office as a new patient, I'll tell you. No, I'm just kidding. I don't get my new patients like that. But it's funny, they're like, hey, my dentist knows nothing about this. My dentist knows nothing about saliva, digestion, absorption, and intermittent fasting. Can I get your card? So I'm always giving out my location because people are fascinated by a dentist knowing about nutrition. And I'm espousing as much as a dentist would know because we take about 22 hours in our 4 years. We know enough to talk nutrition, but we always think it's outside our scope of practice. Oh, I'm doing keto, I'm doing paleo, I'm doing Dukin, I'm doing Weight Watchers, like I'm doing Nomi or Numi, So we look at foundational principles. It's amazing how good we can sound in front of a new person. And they're thinking, give me your card. I've never heard anyone talk about this before. If you're a dentist, my family's coming to see you. And that's how quick those things happen. So when you talk about guiding principles rather than details, it's amazing how attractive that sounds.
Yeah, that's awesome. So let's talk about number 3. We're actually going to talk about teeth as one of the components in nutrition. Tell us your perspective on that.
Well, as a dentist, we know about teeth. We know about curve of Wilson, the curve of speed. We know about restoring arches. We know that, replacing, if you have a missing tooth, replacing with individual implants is better than doing bridges, better than partials, better than leaving them alone. Anytime you have solid eating tools, you will chew better. So when I'm talking teeth, I don't just talk, most people come into the dentist to get out of pain. You'd be surprised when people actually think, I don't need to go to the dentist, my teeth are fine. Why? They don't hurt. So getting out of pain or appearance is the most common reason why people come see us. However, you start talking about chewing better, you start talking about the reason why teeth are designed a certain way. People are floored when you talk about, people think, wow, like what kind of Kung Fu Panda dentist are you? I say, yeah, the incisors are basically to cut and sever. And then it goes back to wider teeth and then broader teeth for chewing purposes. People go, I've never heard that before. How come I'm 60? I've never heard that before. So patients love it when we talk about old school dental anatomy. So you talk about chewing function. You talk about the fact that they're missing their first year, their 6-year molar on one side, and how now they chew more differentially on the other side, and how that's hampering their mastication. And if they're not chewing better, it means they're not absorbing food better, which means accelerated aging, increased amount of calories eaten. Because if you and I, so Kurt, if you had 12 teeth and I had 28 teeth, we ate the same food, you'll be hungrier later, because even though we ate the same calories, you will need more because your body wasn't able to break it down and absorb the nutrients. So you will still be hungry. So 28 teeth, the body's better able to cue in, and the body's able to better decipher they've eaten and able to absorb the nutrients. So full arch cases, it makes sense to me. So we start talking to patients, and you can make difficult dental anatomy, and the reason why teeth are designed a certain way to chew better and absorb nutrients better, we seem like some kind of sensei, like some kind of Lao Tzu talking about making sense of the body, because it's still a mystery. Right. If you ask the average person, which side is your liver on? I've got an MBA. I have no which side my liver's on, but if the liver ever left them, they'd be in toast. People don't often know actually the heart's actually more in the center than on the left side. We don't understand the body. It didn't come with a manual. It didn't come with an instruction guide. And when you don't have a good guide, you end up with chronic disease, pre-diabetic, diabetic, aches and pains that don't go away. And then we try and explain to patients about nutrition and overall health. And we ourselves have a hip that hurts. We have reflux. We have a fading memory. So I think when we're better able to lead the way, I always say you can't take a patient on a journey that you haven't been on. So get in shape first, right? Or be on that journey first. Now that patient can listen to you because you have a more authentic voice when you're communicating about total body health.
Right. And we're talking about total body health. Talk about this, the absence of teeth as people age. This is where I feel like you get to talk to dentists all the time. They're like, oh, they look in this finite world. There's only so many dentists. There's only so many patients. Well, the biggest problem we have we've got a lot of challenges is the aging population. I mean, 1 in 3 babies that's born today will actually live to be 100. Right now in Japan, adult diapers are outselling children's diapers. Like, we're getting older. Talk about how important dentists will be when you talk about number 3, which is teeth, or the absence of teeth when people age. My mom is 20 years older than me. When she breaks a tooth, it's the end of the world. Like, she can't eat, she can't function. Mm-hmm. Dentists are going to be busy for a long time, don't you think?
I get it. I get it for sure. And I think dentists are always worried about this small patient pool. I think someone's saying that half the patients only go to the dentist once a year. So the other half go when they need to. So 160 million North Americans go less than once a year. They're open season on those patients. So you could totally get them in. But when you're talking teeth and the aging population, obviously there's the graying of America, the graying of Canada. I think they have the most dental concerns. They have the largest amount of multi-surface amalgams and composite fillings. They're most often likely going to fracture off an endo-treated crown, and now they need an implant or crown lengthening on a new crown. I think when we start looking at patients as the fact that as they get older, the needs come up. Like, a brand new Porsche needs high maintenance, but a 10-year-old Porsche needs premium maintenance. You need that aficionado, that person with an overall vision of how teeth are supposed to look. So the aging population, their needs are more. Everyone wants to look and feel good. Look at Biden, 77, Trump, 74, Sylvester Stallone, 76, Rod Stewart, 75, Arnold, 73. No one's going away. They're working. Trump says, I'll see you in 4 years. I'm like, he's going to be 77. He's not saying God willing. So these baby boomers, people born between 1947 and 1965, they have high expectations for their minds, for their careers. They're not letting go. So we got to help them know teeth are much more than looking great in your headshot. Right. It's about digesting and absorbing food better. And whoever absorbs food better is going to have less inflammation, longer life, better mental clarity, flatter stomach, possibly have a six-pack, and more hormonal balance, testosterone, estrogen, progesterone, growth hormone. Hormonal balance needs ideal foods being brought in. And because only 1 in 5 restaurants, actually, sorry, my fact there. 1 in 3 Americans actually eats junk food every day. So 1 in 3 Americans eats junk food every day. So that being said, we are in desperate need of information about nutrition, and we're in desperate need about keeping care of these pearly whites, much more than the headshot or the Instagram selfie.
Right. Right. Now let's go to number 4, the absorption. It's saliva on the nutrition side. A lot of people don't associate saliva with nutrition. Talk about that.
Yeah. Dry mouth is something that people get when they're nervous. and then my mouth is dry. And I think most dentists know that 2/3 of all prescription medication and over-the-counter medication, dry mouth is a side effect, xerostomia. And xerostomia, for most people, think of as more of a thing of, I'm having trouble talking and I got to sip water more often. Or I'm having trouble swallowing food. You give a patient a slice of bread, and if they need water to swallow that bread, they have xerostomia. But most people don't notice they have dry mouth until they've lost 50% of the saliva in the mouth. By that point, digestion's been delayed. The stomach's making more acid to digest this poorly swallowed food. People don't realize in saliva, there's something called apiorphin. And I didn't know this till about 2 years ago. Apiorphin is a morphine-like pain control chemical that's in our saliva. It's called apiorphin. They say it's even stronger than morphine. It's in a very small amount. So when you're salivating, the body is in one way is trying to give you pain relief. So this is powerful stuff. The saliva is much more than just something that helps you wet your whistle. Digesting food, speaking, clearing food from the interproximal. Just food getting stuck and people unable to enjoy a post-meal conversation because of dry mouth. But is there a dry mouth solution? A number of them, but again, a lot of them in experimental stages. Artificial saliva, xylem melts. Periosciences has something. Biotine. I think GlaxoSmithKline bought Biotine. There's a few saliva stimulators, but you still can't replace the thing. Someone actually told me saliva is almost like your blood because it's like blood without the pigment. That's how they're able to do DNA tests with saliva swabs. Like saliva, it needs to be your friend. I remember there was one professor at University of Manitoba back in the 80s when I went there. He was the king of saliva. I can't even think of his name now. But he lectured all over the world, and we're all like, gross. What's the big deal about saliva? I'm a dental student. It ties it all together. Ties it all together.
Yeah. Talk about this. And again, I'm speaking way outside of my circle, but there was a great dentist who's a friend of mine, Dan Rosen, years ago in Austin, Texas. He would test the pH balance in kids after eating breakfast. Some of them eating like pancakes, others eating a little bit more of a balance. And he would show the difference of the composition of the saliva and how it affected them throughout the course of the day. It's not so much just that the fact that you have saliva, it's the composition of the saliva, right?
Yeah, it's dry mouth, it's alkalinity, acidity. They just said if someone snacks 6 meals a day, they have 6 acid challenges every time they eat. That's why if you just eat 3 meals a day or 2 meals a day, you have less acid challenges. So less cariogenic diet is as an intermittent fasting diet. So alkalinity and those little testers see if someone's acid or alkaline, maybe a little bit beyond, the trusted science of what you teach in universities. I know my naturopath talks about those and osteopath talks about those. And I think it just makes it a little bit confusing. People start talking about litmus paper. Patients are confused enough. I remember my mom, who loved nutrition, at age 70 says, I thought calcium and vitamin C was the same thing. She goes, because they first start with C. So my cute little mom who knows tons about healthy eating thought calcium and vitamin C was the same thing. So right. You bring alkalinity and acid testers in the mouth, anything that makes nutrition more complicated, patients drift away from.
Right.
So when I talk about common threads, and I'm glad you brought the subject because I'm sure the dentists out there saying, I test with litmus paper. Well, go ahead. It's like the guys who are on diets and they're putting this litmus paper in their midstream urine. Where the hell is midstream urine? But they put litmus paper in the midstream urine to see if they're in ketosis. I'm like, I've never done that. I did it once when I was 19 and I was a little off the rocker thinking I want to get lean, but it has very little to do with sustaining a healthy diet because anything that's complicated is not sustainable.
Right.
So if your diet is measuring litmus paper, midstream urine, doing all kinds of tests, it's not sustainable. Like when I look at my patients who are in their 90s, good teeth, my 100-year-old patients, I said, what brought you to this day? I eat porridge every morning. What's your fitness thing? I've been walking my whole life. People who in it for the long haul seem to have sustainable, easy, doable activity and nutrition habits. Yeah. So when people talk about keto, paleo, 16 and 8, 12 and 12, are you going to do that for the next decade? Anything you can't do for a decade, why are you doing it all? Like it's got to be sustainable, doable, and easy. Sustainable, doable, and easy makes it something you can do over a whole lifetime. And then you'll get the results. It's like compound interest. You start putting $1,000 a month aside. Most dentists go, it's been 4 months. How much money do you have? You have $4,100. But you put $1,000 aside for 30 years. Now you got a $2-3 million. So doing doable, easy things daily that are sustainable is like compound interest. And dentists understand that one. But you make challenging, where you make dieting challenging. All of us now, it's like checking a little seed you just planted. Hey, nothing's going on yet. Give it 100 years, it'll become an oak tree. I know, but 3 days in, how's it doing? So we become very impatient with our health changes. But compound interest, think about long haul nutrition.
Yeah.
Anything I do now, it's stuff that I could do for the next 10, 20, 30 years. Anything I want to do for the next 7 days, what's the point of it? Like, what is the point of it?
Yeah. Amen, brother. We got to keep things simple here. So in number 5, talk about you mentioned performance nutrition as a big component of the overall nutrition conversation. What does that mean?
Well, 85% of the population doesn't exercise. 85% of the population doesn't exercise. 85% of dentists, 85% of our patient pool. Only 50% exercise with enough intensity and regularity to say they're athletes or they exercise. So they have different nutritional needs than the layperson who's basically struggling with their belly over their belt. But when you have, when you think about it, performance nutrition is anyone who wants next level. And most dentists have barely treading water with nutrition. So you get an athlete in the chair, they just don't know. You got to know what's one of the best books on nutrition. Have it at your fingertips. You got to have access to dietitians and performance coaches in your area, so you could be the referral source. If you're the referral source, I'll get a mother coming in. My 14-year-old son plays hockey. He's drinking Gatorade. I wanted to see if I can get him onto something else. Does my kid really need that Gatorade? And is it bad for his teeth? Most dentists go, well, as long as it's artificially sweetened, it should be fine. But have access to the referral of a dietitian or performance nutrition coach in your area. That'll be, now you're seeing as a trusted advisor. Now I'm helping out a family, and I don't have to be the buck stops with me. I don't have to micromanage this family's nutrition device. All I got to know is understand the basics, but have people I refer to. Guess what happens when you refer to dietitians and performance nutritionists in your area? What happens is they refer back to you. You refer to chiropractors, you refer to sports medical doctors, they refer back to you. This is powerful stuff. It goes beyond getting good Google reviews. It's understanding how you can help patients, not be the person that understands all nutrition. So as a dentist, if I had a performance nutrition question, I could probably stick handle probably up 90% of it. But even I myself have people in my area. We have a wellness center just down the hall from our office where they do nutritional coaching. There's a couple of naturopathic doctors there, and I refer to them. And now I seem like the hero. I've taken the mystery out of the referral. Comes people and go, oh, look online. Look online. My dentist says there's a naturopathic doctor just down the hall that's very good with athletes. And now I'm a trusted advisor. A great way to cement that relationship and build a better lifetime bond with people, which is basically, I want patients for 20, 30 years, not for the short term.
That's awesome. There are people that fix teeth and there are people that change lives. And that's what you're talking about, making a big impact on people. Now, I get a lot of things wrong. So, listening to you, I'm always motivated, always inspired. What do you think most people get wrong just from the get-go when it comes to nutrition or dentists? Like you get to talk to a lot of people. I know you're coaching people on nutrition. When you're out there on the road, what's the number one thing they get wrong with nutrition?
Most people, when they want to eat healthy, they cut calories. They cut calories. So cutting calories is not that good of an idea. I'd rather increase my activity, keep my calories the same. And I've done it before with my coaching. Keep your calories the same, just tweak the quality of the food. So keep your 2,500 calories a day the same, but change them. And now all of a sudden, those 2,500 calories are hard to stuff in because you're eating a salad, you're eating a sweet potato, you're eating more fiber. So now they're saying, hey, I can't even finish all my food. The calories are the same. They've just changed the quality of the food. So when you start changing food quality, it's easier to stay on a healthy diet because the food quality improves and now you automatically lower calories. Do you know that people that go on a plant-based diet, not necessarily strictly vegan or vegetarian, but people go on a mostly plant-based. So I'd say 70% plants, 30% food. Right away, they have a 300 calorie a day deficit in their calories. So even if you start eating more vegetables and you try and eat the same amount of food, what happens is you're in a 300 calorie a day deficit, which adds up to losing 1 pound of fat a month. In a year, that's 12 pounds of body fat. That looks great on anyone, from a speaker to a writer to a lecturer to a mom to a dad to an athlete. And that's also just by eating a few more vegetables. Eating a few more vegetables a day, right away, the body becomes a better fat burner. It increases the metabolism by 11%. But also, you have a 300 calorie deficit, which automatically makes you start losing up to a pound of body fat every month, just by eating more vegetables. So the number one mistake is cutting calories to get healthy. Cutting calories has no place in 2021.
Yeah, I love it. I love it. Well, give us a couple good words as we wrap this up. I know I only get you for so long, and I know you're a busy guy, but Give us some final words on how dentists can put nutrition together for themselves and their patients.
Well, I've never followed one particular diet over 10 years. I eat very intuitively. The whole idea is some of the masters actually, Michelangelo wouldn't actually tell you how many hours a day you should paint to do what he does. He goes, I'll paint until. So I'm a very intuitive person. When you think of Stephen Covey's unconscious competence, I'm in that fourth level, not bragging, with all humility. I've gotten there by struggle. I can show you my before picture, but I'm unconsciously competent now at eating healthy. So one way they could actually do it is to learn the language. So join me on Instagram. Instagram is where I shine. I've posted maybe 4,400 posts in the last 8 years. I still answer direct messages, but I post about 2 or 3 times a day. It's all cool stuff. It's all the different articles that I read. I'm certified in a couple of different personal training organizations. I get the latest journals. So I make sense of probiotics. I make sense of intermittent fasting. I showcase a four ingredient breakfast that can be made in 4 minutes. So by making it doable, easy, and I share it, people ask me questions. That's the best way to learn, is to learn the vocabulary. So join me on Instagram so we can keep the conversation going, like Oprah after the show, okay?
Yeah.
So join me on Instagram. So my Instagram name is @FitSpeakers, @FitSpeakers. So read the back posts, direct message me, ask me the kind of why I still eat ketchup sometimes, because organic ketchup in Canada has no high fructose corn syrup in. So regular ketchup, high fructose corn syrup. In Canada, organic ketchup made by the same company has no high fructose corn syrup. High fructose corn syrup has no shut off message for the body. So you start looking at lowering the amount of processed food, changing up the qualities of some organic if you like. Follow me on Instagram, learn the vocabulary. It'll make this whole journey easier because the words will spill off naturally chairside. And I have this great article on my homepage on druche.com. So it's a 5-page article I wrote with a hygienist, and it's called Gut Healthy Chairside Conversations. So it's a 5-page article, 17 references. Read that article, print it up, highlight it, message me, follow the hygienist that I co-wrote the article with. And we can make this journey to fitness and health so much easier, so much more easier.
I love it. Now, for the benefit of people listening to iTunes or Spotify, what's your website to get that article?
Okay, so that's druche.com. So druche.com. So Dr. Uche, druche.com, druche.com. So on the homepage, there's a few different articles available. There's one called Gut Healthy Chairside Conversations I wrote with a hygienist. The other thing is my Instagram is @FitSpeakers. So FITSPEAKERS. That's me. I'm posting 2 or 3 times a day. Like some people say, Uche, why are you giving so much stuff away? Because I have so much more inside. And like the Buddhists say, if you want to let more tea into a cup, what do? You got to pour it out. So I give lots of stuff away because I'm filling my mind up with more stuff. And by sharing it, my retention goes up 90%. If I learn something new and don't tell anyone, 2 days later, I know 10%. But if I share something I just learned, my retention now gets sticky. It's now 90%. So because I share every week, this stuff is like glue. I dip my hand into a book, I share it, it's stuck to me like glue, you know? So, but the references are there. If they want the references, I have them. So just learn the vocabulary, keep the conversation going.
Yeah, buddy, you're one of the greatest givers in dentistry. And I'm not a social media guy at all. But in Instagram, your Instagram is great because I love when you're doing the cooking thing or you're describing something. It's absolutely fascinating. And, every time I watch it, I'm like, gosh, I got to be a little bit better, So not only you're sharing, but you're also inspiring, brother. Now, I know you're speaking a ton. I would call you the most popular speaker in dentistry, hands down. Everybody wants you to speak. You're doing, I don't even know what you're doing this week, but I also know you're doing the Seattle Study Club Symposium. So I'm going to put up a graphic. I think it's one of the greatest events in all of CE. Can you talk about what this organization is, Symposium, and what you're going to be doing at the Seattle Study Club Symposium Virtual Summit?
Well, I feel honored. 75, they say 75 world-class speakers. So I know, Kurt, you've done that 10 times. Like you're like one of the hardest working men in show business. You're like the Sammy Davis Jr. of the symposiums. You're there every year, right? Come hell or high water. So it's my inaugural time. They said, Uche, we need you there. So I'm doing one program. I think it's on Saturday. I'm going to be in the Q&A, actually rifling through questions and answering it. My talk is on total health, for the spouse or the healthcare provider or the team member. But, dentists, they want to know about veneers and crowns and implants. food, nutrition is the number one thing that you got to know more about. It's the why. It's the why we want to restore an arch. It's the why we want good intercuspation. It's the why we want pain-free joints. So I'm doing an hour on Friday. I think it's 7 o'clock Eastern time. So I'll be at some Seattle Symposium. Friday though, I'm doing Yankee virtually. I'm doing Yankee virtually. Doing a live exercise program at 7 a.m. in the morning, 10 o'clock, patient lifestyle health. It's the same morning that a moving truck is coming in, so I'm moving. I've delegated. I'm no longer micromanaging, but because it's who I am, it's not memorized. It just comes out of me. So it's just like it's who I am. So it's in those conversations that people learn that nutrition, fitness, health, inflammation, ergonomics, it should be effortless, doable, and daily. You know, I know people that teach ergonomics, they have like 32 stretches. 32 stretches. I know some of these experts haven't stretched unless they got to pick up their deposit to hand in, because everyone pays in full when you get really good at dentistry at the time of prep. So very few dentists are stretching, but it's all about, you can simply just go against the wall. This is like the easiest one ever. It's all about reminding your physiology. So you go against the wall, stand up. So your back, your heels, your butt, your upper back, and your head's against the wall. You put your hands up against the wall and you slide down gently. Again, this could ache for some people because most people haven't put their hands above their head in a long time, but you slide up and down gently, very gently. If you have any limitations, see go to a physiotherapist. But that's an easy reminder to your whole nervous system how it's meant to stand and how you're meant to work. But it's doable, easy things. If someone just does that once a day or most days, you can be well on your way enjoying a practice life for more than 10 more years than the average dentist, just by giving your nervous system a gentle reminder. So all this and more, I just want to develop a curiosity for dentists in looking at total patient health. Total patient health is where this is going. Wellness is where dentistry has to go.
Yep, totally. I would say two things. Number one, if you haven't seen Uche speak before, or if you have a study club and you're looking for a phenomenal speaker, Uche's your guy. I mean, you do make this so crazy interesting. And I don't even know how you do what you do, but it's so energizing. And, you know, he's not slide specific type of a guy. He's very engaging. And then number two, I'm going to have you back over and over again, because that's one of the shows I want to do with you, is just the some simple exercises just to proactively take care of your body as a dentist. That would be a great one too, because we see it too often, young dentists that have a lot of pain, whether it be in their neck, their back, or whatever. Dentistry is a sport and you've got to prepare for it.
Well, a day of pain. I remember the other day, I think a rib, and people don't talk, my chiropractor calls it when a rib comes out. A rib, not he pops out through the skin, but it gets out of place. You have a rib out for a day, 2 days, you feel older all of a sudden. And some people walk around with chronic pain all the time and they really feel their age and older. So if your neck's out, herniated disc, joint laxity, tennis elbow, meniscus tear, hip issue, it makes you feel older than you are. So you can fix it by going to the best people, Egoscue in San Diego for back. However, prevention, preemptive strike is the best way to go. And dentists are all about prevention. We are all about prevention. So stay pain-free. And if 30 you're aching, what are you going to be like 30 years later with 3 practices, 4,000 patients, a staff of 35? So I think it's important to be preemptively healthy, but doing daily, easy, doable, sustainable stretches and exercises. So to become a no-brainer. It's all about unconscious competence is the way to go. Anytime you're actively working on something, it takes lots of energy. You want to get to unconscious competence. It's above the clouds nutrition. It's above the clouds ergonomics. It's above the clouds movement. And that's where life gets easy and effortless. It's the Richard Branson style of movement where you're just chuckling and laughing. I don't think he even carries a cell phone. That's the kind of CI I want to be. Above the clouds, looking at it from a global perspective, transformational. So if you're working hard, hammering it out, talking to your people every day and hammering it out, that is efforting. That takes energy. Above the clouds, sustainable, easy, doable, fun, effortless for a lifetime.
That is awesome. Well, like I said, brother, you make our lives better every single time you share something. So I am so crazy grateful. Make sure you follow Uche on Instagram. You'll love it. It's very entertaining, insightful, informative. And we're going to keep having you back over and over and over again. And if, I shouldn't say if, but when seminars come back, this is your guy you want to go see. He is awesome. So Uche, stick around while we say goodbye to everybody else. But thank you guys for tuning in to the Best Practices Show. If you enjoyed today, which I know you did, just do us a favor, hit the share button, share with your friends. Keep sending us suggestions for things that you guys want to see from Uche or from other great speakers in dentistry. We're lining up now. And until we see you guys next time, keep watching the Best Practices Show. You guys enjoy the rest of your day.